The DMC is part of the Sepsis Collaborative. We actually participate in two different sepsis initiatives with the Society of Critical Care Medicine throughout our whole hospital. We participate with them for the Acute Care Collaborative, which is for patients that are on a med-surg unit who develop signs and symptoms of sepsis, with the goal being to try and identify patients early to help reduce mortality. We've also been participating with our patients that come in through the emergency room or develop sepsis in the ICU. So we submit data monthly to the Society of Critical Care Medicine, which allows us to compare ourselves to other hospitals. It also allows us to help build the research that's going on in the world of sepsis, looking at what we can do to help improve patient outcomes. So sepsis kills regardless of age, race, sex, economic status. It kills everybody equally. The only way to stop sepsis in its track is to recognize the signs and symptoms early and to get to an emergency room so that you can be treated very, very quickly for your sepsis. The signs and symptoms of sepsis are very subtle, and often they mimic many other things. They're a little bit faster respiratory rate, so you're breathing a little faster. Might be a heart rate that's a little bit faster than normal. It could be an elevation in your white blood cell count, or it can be a low white blood cell count, and a fever, so either a high temperature or a low temperature. Things that are often easily overlooked because we have many reasons to explain why we might have a faster heart rate than normal or why someone might be breathing a little bit faster than normal. Probably one of the most important things in terms of sepsis is early identification, which leads to early treatment. The DMC has spent a lot of time educating all levels of healthcare providers, physicians, nurses, nurse practitioners, PAs. We're even going to start to educate our patient care associates so that everybody will consider sepsis an emergency. Our motto is to identify patients early so that they have the best possible option for treatment. Early identification leads to early treatment, which leads to better patient outcomes, and that's our ultimate goal. In October, sepsis is going to become one of the core measures, meaning that CMS is going to start looking at how well hospitals do in taking care of their patients. So there are going to be certain metrics that hospitals are going to be expected to follow in terms of bundles of care that we want patients to receive within a 3-hour time frame and then within a 6-hour time frame. The DMC has been working on those bundles for the last couple of years, so I think we're going to be in a good place once that becomes a mandatory core measure. The DMC is currently participating with the Society of Critical Care Medicine in a collaborative for early recognition of sepsis for the patient that is in the hospital that is not in the ICU but rather on the regular floor, a place where patients have the highest chance of dying because in those patients sepsis is recognized late. So we are participating with them, trying to generate some evidence as to what's the best way to identify patients quickly that have sepsis and intervene quickly so that patients will have better outcomes. So we are submitting our data every month to the Society of Critical Care Medicine. We are being benchmarked with other hospitals within the whole United States, and then we kind of get a report card to see how we're doing with our sepsis, and we are generating new research as to how to better improve care of sepsis patients. And the DMC was actually asked to join this collaborative because of all the work we've already done on sepsis, especially on the regular nursing units. The DMC and Tenet Health System have adopted the model of no sepsis, and it's no spelled K-N-O-W, with the no being emphasized because our goal is for everyone to be aware or knowledgeable about sepsis, and then for us to stop sepsis in its tracks so that patients don't die. Because if we identify sepsis early and treat patients quickly, the mortality rate or the death rate from sepsis drops substantially.